morning, everyone, and a very warm welcome to all present here on behalf of the Department of Health Sciences. As you all know, we have gathered here for a session on emerging evidence on yoga for mental health, an incredibly timely and important topic. This event is a proud collaboration by the Ramkumar Rathi Patanjali Yoga Chair and Ayush Center of Excellence, both housed within the School of Health Sciences at Savitribai Phule, Pune University. It is a privilege for me to introduce our distinguished speaker, a true luminary in the field of mental health, Professor Dr. B.N. Gangadhar. Professor Gangadhar is a renowned psychiatrist and a pioneer in the clinical and research applications of yoga for psychiatric disorders. He has an extensive career spanning decades with significant contributions to both academia and public service. He is the former director of the National Institute of Mental Health and Neurosciences, NIMHANS, Bangalore. He has also served as the chairperson of the National Medical Commission, Distinguished Scientist Chair for the Department of Ayush, New Delhi. His research on topics like electroconvulsive therapy, schizophrenia, and community psychiatry is widely published in national and international journals. Over 450 publications and 15,000 citations. Sir has also been awarded Padmashree in 2020. Professor Gangadhar's work has been instrumental in bridging the gap between traditional practices like yoga and modern medicine, and his insights are sure to provide us with a deeper understanding of this fascinating subject. To formally commence the program, I request Professor Patwardhan sir to deliver the opening remarks.
Thank you. Good morning, all the students. I am so happy that Dr. Gangadhar is here. We know each other for a very long time, and I must tell you that those who know that we have worked on the Prakriti concept here, finding genetic basis to dosha Prakriti, Vat, Pitta, Kapha. One of my inspiration came from his work, in which he had talked about the similar aspect in yoga. Yoga also there is a concept of three guna, and he tried to really find out that correlation, and he published sometime in late 90s this paper, and I happened to read that, and then I thought that this can happen in yoga, Ayurveda also we must think of. So you can imagine that the 4 decades of innovative research he carried out as a psychiatrist, and must remember that in mainstream medicine, and we have here many eminent mainstream medicine people with us, Brigadier Rajan, renowned cardiothoracic surgeon, Dr. Pranjal, very renowned neurologist, and Dr. Agar Khedkar, very renowned pediatrician. All of them are modern medicine people, with here like them, Dr. Gangadhar is also modern medicine person. After doing MBBS, he did his psychiatry and was director of one of the top institutes in India. Getting open-minded physician scientist is not easy, and today we are blessed that all of them are here with us. I'm also happy that the yoga enthusiast, and I am told that he was yoga teacher also for quite some time, Dr. Parag Kalkar, who is our Pro Vice Chancellor, is also here with us. And I was telling him that looking at him, the fitness secret is very, very loud and clear. So he is an example and kind of an ambassador for propagating yoga to others. So thank you for coming here. I'm also happy that Rahul Rathi is here, son of Ramkumar Rathi, with whom we have been interacting for several years. One of the very well-known industrialist and philanthropist who established this Ramkumar Rathi Patanjali Yoga Chair. So students, I am not going to be in between you and Dr. Gangadhar, but I just want to tell you that he is the person. I don't know how many of you know about NMC. Like earlier, there used to be a very scary word, for the medical council. I don't take that short form also now. That was transformed into National Medical Commission, which is known as MNC, which controls the entire medical education in our country. So he was chairman of National Medical Commission, and during his tenure, he did one of the most difficult things. During his tenure, he ensured that in NMC logo, if you look at the NMC logo now, you will see Dhanvantari sitting in the NMC logo. To me, this was the most difficult thing to do, because Dhanvantari is considered as Ayurveda icon, and that Ayurveda icon is coming in a logo of allopathic medicine or medical commission's logo. This gave a very, very strong message to the community that we all are one as far as our country is concerned, and we should look at public health first, we should look at people first, forgetting about war of turfs. So thank you, Dr. Gangadhar, for this, and please invite you to come here.
To honor our blessing and a token of gratitude, I would request our Pro VC sir to please come on the stage and felicitate sir.
A very good morning to each one of you here in this hall. I feel honored that you have invited me to address and present some concepts on integrative and traditional medicine. I feel that this is an honor that you have bestowed, and I thank you for letting me come here. In this talk, I will illustrate the approach that can be followed to demonstrate evidence for a traditional systems of intervention and put forward ways in which how this can become integrated. I am taking an example of mental health here because being a psychiatrist, I can understand this better, and the work that we have done. Of course, there are many people who have worked on this area, though. Perhaps stories such as this, framed and developed for other conditions, put together, will eventually unfold into a strong integrative model of healthcare that we need to promote. So here I am talking about evidence building for integrating yoga in psychiatric practice, mental health in general. We have put all these things together under the banner of Ayush, and the academic head of Ayush is with us, Dr. Patwardhanji, is the leading scientist who is spearheading much of the modern science research in Ayush area. So I am in fact very privileged that I am addressing you in his presence. We of course have used for millennia these traditional systems, and they have stood the test of time. And in fact, any treatment is considered as having passed all the tests if it passes the test of time. Ever since I started learning psychiatry about 40 years ago, I know at least a dozen medicines that I was using as a student today don't exist in the market. So short-lived are many medicines that are introduced. The time testing has killed them. The test of time has killed them. But many of the procedures that are continued to be used today over the last, I don't know how many millennia, have remained, and they are used in the same way and in the same tradition, which means their time-testedness, it has passed with a distinction, or whatever word you want to use it. So is yoga, Ayurveda, and so on and so forth. So time-testedness is very important criterion. And what is important is we need to be inclusive and need to find a way of integrating these things, and that's precisely what I am trying to talk about. And the Health and Family Welfare Department has made several progresses to facilitate this integration. Although buying that concept and making sure that it actually unfolds has had several challenges, but let me demonstrate towards the end what steps the Government of India has actually made in terms of facilitating this to happen. But most important thing from the academia part of it is to build evidence. And this evidence building has been a call that has been given by many people, and it's a recent one of the commentary papers or a point of view papers written by a very, very senior psychiatrist who says that traditional systems of treatment need to be examined and evidence has to be strengthened to make sure that it becomes into a mainstream application. Dr. Srinivas Murthy was earlier head of the Department of Psychiatry at NIMHANS, now retired, and has been my teacher. He said it in an international journal called the Asian Journal of Psychiatry. And having given a call for this more recently, but since last more than 2 to 3 decades, people have been looking at the science of yoga and the science of the medical science component of yoga. The PubMed is one of the well-known indices which archive all the publications, and in the last, since 1940 to now, so 75 years, close to about 9,500 articles have found indexed in the PubMed if you search by the term yoga. And almost 75% of those publications came in the last 15 years. More interestingly, in the last 1 year, almost 10% of the articles have been coming. 2024, the hits accounted for about 940 articles. So the message I am giving is that yoga is rapidly gaining attention in health-related research and applications. And I think one of my student mentioned to me, although it was a revelation to me, when I had to give a talk on yoga in some meeting, he said, choose yoga as a research in health sciences, you are more likely to have a higher H index. He said Dr. Gangadhar's 6 of the top 10 highly quoted articles are in the field of yoga, although he has been researching on yoga only in the last 15 years. So that was an eye-opener to me, and I am also saying the same thing. For those of you who are into yoga research, you are more likely to be quoted if you are publishing in that. One of the very well-known researchers in the field of yoga, Dr. Shirley Tellis, has a H index over 80, and she has been publishing only on yoga. So the message is loud and clear, and we need to be doing research and making sure that this happens. So the evidence building follows several steps. I'm sure all of you know: case series, open trials, uncontrolled studies. They all give you some leads, but they don't become evidences. Evidences come from the so-called randomized clinical trials, at least today in medical science, although we can always frown at the randomized clinical trial story because of several other limitations and difficulties, challenges, and impracticality of using it for traditional systems of intervention such as yoga, Ayurveda, and a host of those things. But the fact remains is, in the medical fraternity, RCTs becomes the buzzword to buy an evidence. And now it has moved from RCTs to what is called as multicentric trials. Unless it is demonstrated in multiple centers simultaneously, the evidence for or against a given intervention, they will find it difficult. And of course, people are now beginning to do some multicentric trials. Even in NIMHANS, one multicentric trial on schizophrenia yoga intervention in schizophrenia was fairly successful, and we were able to demonstrate positive benefits of yoga in schizophrenia individuals. And now the recent buzzword in the last maybe a decade or so is the meta-analysis data. Meta-analysis data with quite high effect size is considered as a strong evidence. So meta-analysis has become the buzzword, and it's so become such a addictive behavior doing meta-analysis. There was a comparison of treatment A and treatment B. I'm not going to be telling which treatment A and treatment B is. There are only 6 publications of this comparison of treatment A versus treatment B, but then there are 7 meta-analyses examining the validity of treatment A over treatment B. So this is the craze for meta-analysis, and that seems to be a very strong. There are of course several challenges for doing randomized clinical trials of the designs that the modern scientists, modern medical sciences accept. Can you think of a placebo for yoga? I'm not going to I'll be very surprised if you're going to think of a placebo for yoga. Placebo for another treatment, identical looking capsule, yes, but identical looking yoga, no way you can get that thing. So these are all the difficulties, but we researchers should be continuing to research, build evidence, and that's the only way that can happen. Blinding is another. I'm going to list a few other challenges, not to discourage you, but the fact is that these are all the challenges. Blinding becomes very difficult. Like I said, identical looking capsule, the placebo. Morning, Dr. Patanjali was telling me about copywriting of the yoga by many schools. And this copywriting again comes in the way, and people have to bring in what is called as generic modules of yoga. And where do you do the research? You do the research in a yoga center. Those who are motivated to do only yoga and they think that yoga works, and the faith for yoga, they come there. Those who come to the allopathic center where we can do the research in the modern science, people come with a belief that this hospital is known for modern allopathic intervention. And when we say, you would like to admit yourself for a yoga study, they will frown at us. In fact, there was a publication made from NIMHANS, which of course you know, NIMHANS is a premier institution for modern treatments in psychiatry and neurological diseases. For getting 114 patients of schizophrenia, the researcher had to go through as many as about 1,600 patients, screen them. Only 900 people became eligible to the study, but only 114 people thought that NIMHANS is worthy of doing any research on yoga, and they thought this is only known for modern treatment. Where do you ever learn yoga? No way. We are not going to go through the yoga trial in your institute. So these are all concerns that I think we need to perhaps, particularly in psychiatry, we need to depend on subjective measures. This is again sometimes can become a negative point. And of course, more often than not, patients want the concurrent treatment also. You giving the antidepressant or antipsychotic, some medicine you please give. Along with that, we will do yoga in your trials. And the concurrent treatments is another issue which clouds or masks the benefits of yoga alone being given. Although some attempts have been made and we have been successful in getting this to happen. And of course, yogis, if somebody is sitting here, a yogi will believe that yoga should be performed only by a person who is mentally fit. In fact, unless you are very well composed, you won't be able to pay attention to yoga. So, in fact, initial presentations of yoga in mental health in my work, I received this criticism saying that a person is so preoccupied, so disturbed in a mental state. How did you ever get him to do the yoga? It is impossible, and we don't even believe that what you have done is yoga. So these are all the challenges that we get in. So these are all the points that I am going to cover in this next few minutes of this talk. Like I said, this meta-analysis. Yoga has been examined in many disease conditions in psychiatry. If you take mental health, mental disorders in general, yoga applications have a strong case that use yoga, their mental health conditions get better. This is a very broad assembly of various psychiatric conditions. Yoga helps. You looked at depression. This is an older meta-analysis. More recent meta-analysis also has come 2021, which repeats the same observation. Yoga is better than treatment as usual. Yoga is better than relaxation. Yoga is better than physical exercise when given in addition to whatever treatment that is going on. So yoga has a case. This was published almost 15 years ago, and now more and more meta-analysis are coming. In fact, this meta-analysis looks at depressive symptoms getting better with introduction of yoga, irrespective of the diagnosis. Depressive symptoms actually get better with the treatment, with the intervention of yoga. So there are of course many other meta-analysis and studies. I am not going into those details, some done in our own institute and some done elsewhere. But the point is, all these have finally influenced some of the treatment guidelines. One of the treatment guidelines I am referring to is a Canadian treatment guideline, which says yoga should be used as an adjunct in mood disorders. So yoga has entered the market, which would perhaps lead its way to insurance coverage and so on and so forth. Yoga has been extensively tried in anxiety. The effects are not very strong, but of course there is some effect. Yoga has been tried in post-traumatic stress disorder with very positive influence. In fact, there are many studies which have demonstrated PTSD symptoms get better with the treatment of yoga in addition to other treatments that they are giving. Obsessive compulsive disorder, again another challenging psychiatric disorder, not very common though, it's not very widely prevalent, but when it affects very badly in good number of people. Yoga, in addition to whatever treatment that was going on, or waitlisted people, the scores on obsessive compulsive illness came down substantially in these people. Very recently published article by one of our colleagues at NIMHANS. Schizophrenia is a severe disorder, not very frequent though, about 1% of the population. Some places they say about 5% of the population is affected, but the fact is 0.5% of the population is affected. But the fact is this is going to be a condition which is difficult to treat. People get better in terms of what we may call as positive symptoms. The negative symptoms of being amotivated, not very smart, intellectually low, not attending to themselves, being aloof from the society, keeping away from the family members, etc., etc. These negative symptoms don't get better, and give yoga or physical exercise or a wait list. If you can see that blue bar is the bar where people received yoga, more people became better with respect to this negative symptom score. When yoga is added, we say physical exercise or just of course wait list. And this is a trial which we did, a multi-center trial. Again, in the 3 centers participated in this study. Overall results favor that yoga application actually lowers deficits with respect to the negative symptoms and also the cognitive deficiency syndrome that this person has got. And in fact, specifically looking at the cognitive social cognition, this is very important. Social cognition is something that those of you who are psychologists will know it very much better. Social cognition actually gets better when yoga is given in schizophrenia individuals compared to the whitelisted individuals. As you can see, the scores on social cognition get better following practice of yoga. Together, this social cognition impairment being improved and also the negative symptoms having been improved, put together, more people who receive yoga, the blue bar, actually get improvements in the social functioning. Social functioning is a very important dimension, making the persons getting integrated to the family, else these people get stuck in chronic asylums without having to be released to the community. Social functioning gets better, which translates into the people getting integrated to the family. I can give you many success stories talking about the social integration that has happened in schizophrenia individuals who have practiced yoga. Together, again, all these observations of publications on yoga in schizophrenia has prompted the National Institute of Clinical Excellence, a treatment guideline published by the UK Health Services, advocates use of yoga in outpatients who are on chronically ill but are maintained on antipsychotic medicines. As an adjunct, yoga should be used in chronic psychotic illnesses. Opiate dependence, there is reports which show that we began this work during the period when the COVID began. Unfortunately, we didn't expect COVID. Some projects had been launched on yoga and treatment abuse disorders. All became stalled because people couldn't reach the treatment centers. But a tele-yoga practice, a module that we published, became very successful and many people were adherent to the treatment. In fact, one of the measures of outcome in treatment of the substance abuse disorders is how well they are going to be adherent to the treatment. 75% of the people who were on opiate, alcohol, etc., were quite adherent to the yoga application, yoga teaching that we did on the tele-yoga protocol, and we have published this also. More recently, a recent study wherein yoga or no yoga, treatment as usual in both the groups for opiate withdrawal symptoms. Opiate withdrawal symptoms became better, faster when yoga is given, the blue line compared to the red line where yoga was not given, treatment waitlisted people. This is a graph which shows how quickly the withdrawal symptoms related to opiate addiction. This work is going on. There are several other biological parameters that we are examining. Suffice to say that there are clinical validation, clinical evidence, clinical research evidence to support yoga in a spectrum of psychiatric disorders. There are many more, but I am not putting into that here, just to illustrate how the issue can be linked to our practice and integration of yoga into clinical service. Now, like I said, many challenges, blinding, not having a objective proof, etc., have been the criticisms to all this work and to somehow discourage people from integrating. Now, we looked at, are there any biological markers, are there any biological pathophysiological mechanisms from which we have understood the disease, and that yoga intervention actually rectifies, normalizes, or corrects these biomarkers in psychiatric conditions. I will illustrate this in 2 diseases where we have examined, that is, one is, of course, more are coming and other diseases as well, but one of the common conditions, depression, one of the severe conditions, schizophrenia, where some biological markers, where there is evidence that yoga applications actually rectifies the biological dysfunction in a psychiatric disease, depression for that matter. Depression is supposed to be associated, well recorded demonstration of higher levels of cortisol in the blood on the entire day. They have although there was a suggestion that was mooted that the higher levels of cortisol can be a diagnostic marker, that did not become the test of time, because high levels of cortisol can happen in other stress disorders, in many other host of other psychiatric disorders as well. But depression is known to have high levels of cortisol, and in fact a dexamethasone suppression test was also mooted to be a test for diagnosing depression, but of course did not succeed. Yoga intervention in these outpatient depressives with or without antidepressant medicines. The second two bars, the dark red color indicates the proportion of the people who are exposed to yoga with medicines, yoga without medicines, who lost their cortisol levels, who had a reduction in the cortisol levels. Compared to the other group here in the left extreme, where medicine was the only treatment for them, the proportion who lost cortisol was not as high. Mind you, this was not a randomized clinical trial. To that extent, you have to take this observation with a pinch of salt. But in healthy subjects, there are several studies which have shown that yoga practice reduces cortisol levels. This is a bearing on understanding the pathophysiology of depression and a consequence of a series of changes that happens in depression with the HPA axis having been released. Very interestingly, in people who practice yoga as the only treatment, about 19 patients who said that they will take only yoga. In them, the reduction in cortisol and the reduction in the depressive scores were well correlated, indicating that this mechanism of correcting depression was also correcting the biological pathophysiology. In individuals of depression, there is a hypoactivity of the frontal cortex and the hyperactivity of the basal or the subcortical gray matter nuclei, also called as the limbic nuclei. So limbic nuclei are hyperactivated and the cortical gray matter is hypoactivated. So this has a potential to get corrected. For example, one of the practices of yoga is chanting Om. In healthy subjects, chanting Om led to deactivation or hypoactivation of the limbic nuclei, limbic cortical nuclei, starting from hippocampus to amygdala and so on and so forth. So this is a study where Om was chanted and was compared with a non-Om syllable, and it showed that the difference indicated that there was a hypoactivation. You cool the limbic circuits, you are going to cool the emotions, and you cool the emotions, you are likely to have the inhibition of the HPA axis, and inhibition of HPA axis leads to reduction in the cortisol and probably by a process of inhibition of the entire cerebrum. And in fact, GABA, one of the large neurotransmitters, which is an inhibitory neurotransmitter, is lower in depressed individuals. Whether men or women, depressed individuals have lower levels of GABA. Today we can measure the GABA levels directly using what is called as the magnetic resonance spectroscopy, and it showed that the levels were lower in men or women when they had depression. And what happens when you give them yoga? You can see that small peak there, post and pre. The GABA signal in the magnetic resonance spectroscopy in the brain actually goes up when they have practiced yoga. This is a direct evidence that the inhibitory neurotransmitter actually has increased, which actually was low in depression because of stress and whatever may be the reasons. So a correction happened with yoga. We had another method of measuring the GABA tone, what we used as the cortical silent period. Mind you that recording is not from the cortex, but is from the muscle. EMG becomes flatter, and the duration of its being flat is related to GABAergic tone. I am not going into the detailed methodology of how it was recorded and details of that, but suffice to say, the length of this silent period was shorter, the blue, compared to healthy subjects. In depressives, it was shorter compared to healthy subjects. And in the same depressed group, you randomize them into walking or yoga. If you randomize them into walking or yoga, pre-walking to post-walking, although their depressive symptoms got better, the GABAergic tone did not change. Give them yoga, in that 1 week, the GABAergic tone started lengthening to reach the healthy subjects' values inch by inch. So, and again indicating that a treatment such as yoga was the only treatment. They did not receive the medicines. The treatment with yoga had a potential to, in quote, normalize or correct underlying pathophysiology. In both, of course, the improvement was recorded. They got to get better in both the groups. But what is important is yoga not only made them better mentally, but also produced a biological change for the better. This is the brain-derived neurotropic factor. Our brain has to have a constant wear and tear process going on, and that wear and tear has to be repaired, and that engine oil that makes sure that the brain doesn't wear or tear is the brain-derived neurotropic factor. Brain-derived neurotropic factor, BDNF, is lower in depression compared to healthy subjects, and the difference is very wide. As you can see, the effect size is very wide. And you treat them, treated people compared to healthy subjects, the difference gets smaller. In fact, almost zero. Like the same way, the people who were earlier ill and then they became better after treatment, the difference again gets narrowed. That means that treated people tend to become as normal as possible, and the differences between them is lost. So in effect, lowered levels of brain-derived neurotropic factor was mooted to be a biomarker for depression. But like I said, this is a little non-specific, demonstrated in many other conditions, but nonetheless, brain repair during depression has been impaired, and that is one evidence that the BDNF levels were lower. The two blue bars, depressed versus healthy, we also were able to demonstrate it in outpatient depressive individuals. The levels of BDNF were lower compared to healthy subjects. And you treat them, the pink bar, the levels actually start coming up. You give them yoga with medicines or without medicine, you find the same effect. The levels of BDNF actually significantly go up. In other words, another biological marker showing that a movement towards, in quotes, correction of a biological pathophysiology happened with yoga in depression. And we were able to replicate this finding more recently, indicating that the BDNF levels went up pre to post treatment. The work that we published, had shown earlier, was almost about 15 years ago, and this was done about just 2 years ago, and there are of course many other components that have been tested in this. I am not going into those details. Suffice to say, correction of this pathophysiology of releasing BDNF for any correction of the wear and tear happens better in individuals when they are given treatment with yoga. This is an in vitro experiment of the cells grown in a culture and exposed to a toxic stimulant, as a stress. The stress produced not much change in the release of BDNF, which was required to actually get them corrected before the treatment of yoga. And after treatment of yoga, the same cells that were extracted from the individual and grown in the culture, the resilience was better when exposed to the stress of what is called the glucopolysaccharide. They produced more BDNF. So this is an in vitro study. I am not going to those details, but suffice to say, yoga actually facilitates improvement in the brain repair mechanisms by way of increasing the brain-derived neurotropic factor. In people who lost cortisol, the same group of people, the levels of BDNF actually increased, indicating that perhaps cortisol has a method in which it was facilitating brain loss or the gray matter loss or a brain damage more, and BDNF would actually be also reduced because of increased levels of cortisol. If cortisol levels decreased, individuals expressed more BDNF as compared to those where it did not happen. So there is possibly a link, but anyway, this is a serendipitous observation that we have got. We need to do much more work on this. All these repair mechanisms perhaps has a translation into a cognitive domain as well. This is a cognitive event related potential. As you can see here, the amplitude of the cognitive event related potential in major depressives or a dysthymic depressive disorder was lower when compared to healthy subjects. After treatment, the amplitude became taller and better, indicating a physiological correction in the cognition happened with the practice of yoga in these individuals. Sadly, of course, there is no control group and it is difficult to extrapolate this observation. And we know that in chronically depressed individuals, there is a loss of gray matter. In fact, very typically we say, Chita dahati nirjeevam, chinta dahati jeevanam. So when you are chronically stressed and depressed, you are likely to lose the gray matter in the brain. And it is known that chronic practice of yoga mitigates this neuronal loss. Most of us who are not practicing yoga will lose our gray matter as we age. Although we may appear healthy, but we keep losing our gray matter. At the end of this lecture, maybe one neuron has died in my brain as well. So this keeps happening. And you let this person practice yoga chronically. Chronically practicing yoga people, the slope is less steep. So in other words, yoga might have been giving a protective effect, mitigating the loss of gray matter in individuals, which would otherwise physiologically happen. And we were able to demonstrate that in elderly individuals, the speed at which they lose, or all of us, I am also an elderly person, all of us will lose the gray matter is much faster. And the hippocampus is the first area where we start losing the gray matter. I am sure our neurology colleague will testify to this effect. And here the hippocampal gray matter actually went on to not lose its size but retain or even get better. 6 months of practice of yoga, the subject number is very small, 7 subjects who were otherwise healthy. They had no psychiatric illness, but they had what we may call as the mild cognitive impairment. They practiced yoga, it went on to have an increase. More recent studies have also demonstrated increases in the gray matter volume in individuals who were asked to practice yoga vis-a-vis who did not practice yoga. Just morning we heard a study that was conducted in Pune which showed better neuronal circuitry alignments with a 45 days practice of yoga that was mentioned in informal discussions in the morning, which of course again testifies that practice of yoga has a neuroprotective mechanism which might come from reduction in cortisol, improvements in the BDNF, and of course preserving the gray matter. All put together could be adding to the neuroprotective mechanisms of yoga, and that is precisely what is compromised in depression. In depression, you have a series of cycle of events which starts from increases in the basal or the limbic nuclei being active, that leads to reduction in the GABA mechanisms, inhibitory tone becomes lost, and that leads to increases of cortisol, and that leads to reduction in the brain-derived neurotrophic factor, the cortical thinning, and also decreases in the frontal activity. Although in all these areas we were able to demonstrate, we have not done some work on this frontal cortex as well. But this is what happens in depression, and what happens in yoga is totally different. As you can see, the amygdala becomes deactivated, GABA increases, cortisol levels decrease, BDNF increases, and the gray matter, at least in the hippocampus, actually goes on to be built. So a cycle gets uncycled with the practice of yoga. So this is a stronger biological evidence that we have been able to put forward, and so no wonder yoga is manah prashamano payaha it yoga. What actually keeps your mind calm and better is what is called as yoga. And a quick examples of some in schizophrenia. In schizophrenia, the levels of oxytocin is lower than in healthy individuals. And in fact, nasal spray of oxytocin has been attempted as a treatment in schizophrenia, particularly those who have cognitive disturbances, negative syndrome, and social cognition deficits, and so on and so forth. And what happens when you give them yoga? Yoga leads to increases in the levels of the oxytocin, but that doesn't happen in the waitlisted individual. Very interestingly, we were able to demonstrate that the oxytocin gene expression following yoga was better, but that did not happen when a control study sample was there. This is yet to be published, it is in the process of publication. Suffice to say that there is a biological correction of oxytocin mechanisms which are deficient in schizophrenia, but yoga actually corrects them, in addition to, of course, producing their improvements. And lastly, since we have a neurology colleague here, we will perhaps be able to demonstrate this. In healthy subjects versus in schizophrenia, the network physiology is poorer. The brighter areas indicate that there is a better coherence of the network. Here we are demonstrating the default mode network. Default mode network is poorer in terms of its coherence, compared to healthy subjects. You give yoga for the schizophrenia individuals, they get better with respect to negative syndrome, like I already mentioned in an earlier study, but more importantly, the network coherence actually gets better compared to before yoga and after yoga. Of course, it's a pictorial representation of increase of coherence. And this increase of coherence of the networks actually is also associated with the improvements in the negative symptoms of these individuals. So indicating that a physiological correction of the network happens. In fact, they become more coherent, more united, more working together. In fact, the very word yoga is samyoga yoga ityukto jivatma paramatmanaha. Yoga is to unite. And I believe uniting starts in the brain, what has got disconnected and not working coherently, now start working coherent. And so, in summary, yoga has benefits in mental disorders, biological markers are emerging. We can train mental health professionals. Morning there was a talk about that, it was made, why can't we prescribe yoga? And we did a course for the World Psychiatric Association along with the Indian Psychiatric Association. The theme was to promote yoga prescription into psychiatric patients in specific conditions like depression, schizophrenia, opiate disorders, in obsessive compulsive illness, when they can prescribe yoga. And may perhaps be a time yoga therapist becomes a part of the team of a mental health treatment. In fact, mental health is one of the treatments or one of the disciplines which always believed in working together. We had a psychologist, we had a social worker along with a doctor working towards the welfare of the individuals in the outpatients, and also the nurses who were helping the welfare of the patients in the wards and in the community. So a team had an interdisciplinary approach, and today I think is the time that we have to have a yoga therapist in our team, and of course develop curriculum as to what are the yoga practices, and of course NIMANS has developed the so-called generic modules of yoga for each of the different psychiatric disorders, and it's already there in the public domain in publication. So very quickly running through how this has to become an integration. Integrative approaches in healthcare has been talked about very widely, and we know that almost a third of the numbers of physicians available in our country come from the Ayush stream. And we know that while only about 20% need exclusive use of biomedicine, the modern medicine, 50% have been getting better with Ayush treatment alone. And plurality is one thing that is very commonly approached, and barring emergencies, vaccinations, and a few other things, genetic disorders intervention, where modern medicine treatment has made some inroads. In most other conditions, common conditions, Ayush can be used, and so I think we need to look at biomedicine as a complementary, although it might look very revolutionary in my talk, but I think in reality that could well happen. What is the government doing? I was saying that the government was very proactive, and this has shown up in the act that the Parliament has passed. Act was passed in 2019, and it became a regulation, and it was gazetted in the year 2020. And very interestingly, as I am speaking now here, 25th December was the day on which, 25th of September was the day on which the National Medical Commission Act was promulgated, and it happens to be the 5th anniversary of the National Medical Commission having been formed, and just coincidentally I am here with you on this day, 25th of September. And what is important is that the National Medical Commission Act included this statement, that we should work with the two other health councils which are there, Indian Systems of Medicine and the Homeopathy Council. We should work together, have meetings regularly, meetings at least once in 6 months, and discuss what are the ways out, how to integrate our business, and approving special educational modules or programs that may be introduced in the undergraduate course and the postgraduate course across medical systems and promote medical pluralism. This is said in the Act. This is ratified by the Parliament, the highest body which orders us to do what we have to be doing. Having said this, there can be no other reason I need to put forward than what has been said in the Act, that we need to take pluralism to its logical end by way of integrating. And of course, this has been having some challenges. We need to, of course, reduce criticism to each other, facilitate mutual respect, question anything in private rooms and sort out doubts and clarification rather than openly airing viewpoints which are going to be counterproductive to what the Parliament wanted, the pluralism. Each others have to support the conditions which you will find it difficult to treat. I have some solutions and vice versa. I take solutions from your end to treatment in my clinic for my patients. This has happened, and this is precisely what NIMANS has been able to demonstrate. And of course, very importantly, in the public, all health systems should be demonstrating that they work together for the benefit of the patient. It is patient-centric approach that we all having rather than profession-centric approach. I think we should move away from profession-centric approach to the patient-centric approach. And of course, there are researchers which have shown that medical students in a very reputed medical institution in Delhi, when surveyed, said that majority agreed that awareness building amongst MBBS students about Ayush systems is something that they look forward to and that should happen. And some steps in this direction has been taken by the National Medical Commission. I am not going to go into details at this point of time. Researchers have demonstrated that this medical pluralism is very prevalent both within the country and outside the country. And I think we need to respect it, respect the verdict of the patients who are seeking help rather than dictating our views on to these patients. This is the need of the hour. And lastly, opinion makers, lawmakers need to be talking about it. One of the health ministers has been talking about it very loudly. And legal issues have to be strengthened. We have multiple health commissions. We have to come them together, bring them together and get the medico-legal or the legality of practice of health to be smoothened out rather than creating silos and walls. The Berlin walls between medical professions has to be broken. This is the time for it. And more importantly, the national education policy wants the Indian knowledge systems in all educational fields to be strengthened. And of course, medical is one other area where we have to strengthen the awareness of the Indian knowledge system, and the pride in Indian knowledge system will actually facilitate integration even better. So, integration is not a new term. Medical profession has always been an integrative science and integrative practice. And we work together. In fact, physicists worked with medical people, and then that's why the MRIs, images came forward. The molecular biologists worked with us, and so the genetic diagnosis has gotten better. And various biochemists worked with us together, and so we had various drugs that were produced in treatment of modern medicine. So applications have always been together. We believed in integration. Integration should be extended to other fields of health sciences to make it much more comprehensive. And so I think we need to move from this or that mindset to this and that mindset. If that can happen, I think we have brought health services much more. Of course, we have several issues related to regulatory arrangements, including reimbursement and who should give a license to whom, which the license has a confines. Is there any Lakshman Rekha for each of these licenses is another issue that is being discussed. I am sure this act and the processes recommended by the act of we sitting together and coming and taking decisions jointly might facilitate this to happen. So I should stop here crediting such integrative approach for which China has been an example, although we may hate China for many reasons. But for this reason, I think we need to appreciate they work together, brought traditional systems under the purview of modern science. And that led to a Nobel Prize for the malaria treatment that was brought about from this collaborative work of modern science with the traditional knowledge. That led to the artemisinin having come as a treatment for malaria and a Nobel Prize having been there. And I'm sure we have in store many of these things. I think I should stop here, wishing all of you a great Navaratri festival that is going on right now. Ma Saraswati blessed me and gave all this wisdom, and I am thankful, and I bow my head thanking her for this knowledge. I thank all of you for being with me. The work, whatever I have presented here, happened in this yoga center, which of course has now become the Department of Integrative Medicine. Thank you for listening to me, and here is my email. In case you want to send any notes, comments, questions, I'll be happy to reply and keep in touch with you. Once again, thank each one of you and wish you all the very best for the Navaratri.
Thank you, sir, for such a thought-provoking session. And I'm sure that many of us must be having some questions. So this is the time. Please raise your hands. I would just come and...
Yes, madam.
Good afternoon, sir. So I have a question. Like we have been speaking about the alternative medicine and the modern medicine. Now that we see that IM has taken action upon the integration of homeopathy with the modern medicine, CCMP course, because of this, the Parliamentary Act which was taken in 2019, CCMP course was introduced. But now there, because of this stance, those who have already pursued those courses and because of not being recognized by the modern medicine people and who are already working on the field, it has created a lot of confusion amongst those who have like recently pursued the courses. So what is your stance about that, sir?
Yeah, integration has to happen, but I don't know how this approach, merely training one group of using one other medicine may not be the right way. I think we need to develop an integrative model to apply, and all of us should get trained in this. Rather than one getting trained in another one, I mean, the other person refusing to get trained in the other thing. This is not good. This is precisely what I am saying, that this or that phenomenon is not going to help. What is important is the integrative model. In fact, Nimans has been talking about it. I didn't go into the integrative model development altogether in detail. That's a separate issue altogether. We have essentially two methods, co-localization method and a collaboration method. Co-localization method has gone on for last now 2 decades. Integration is still, of course, it is paving way to collaboration. So if in the same PHC, one Ayurveda or homeopathy doctor is sitting in one clinic and allopathy is sitting other person, these two people look one towards the east and another towards the west. There's no way of integration is going to happen. I think they have to look at each other, discuss with each other. In fact, 20 years gave us a golden opportunity to start discussing with each other, learning from each other, and trying to see how we can put them together in a collaborative way. So this is something that has to be encouraged. I think we should move towards collaborative, this and that together, not this or that. You come to my homeopathy clinic or the Ayurveda clinic, or you go to that PHC doctor's clinic. This concept has to now change, that we sit together, discuss. And I think a single window health system, one of the slides I think showed that point also. We need to come up with a single window health support, at least in the primary care level. Although this is what I think the Act is supposed to facilitate. And I think we need to take it stepwise and take it to a logical end, have to bring it as a collaborative effort to a patient care.
Thank you, sir. Thank you for answering.
Good afternoon, sir. Thanks for enlightening us on this topic. It's really a new topic for us. Since being a doctor, yoga enthusiast, plus I'm a counseling psychologist, I would like to know more about the yoga therapy which you mentioned right now. There's a course which is like, how can I develop myself into this field, like yoga therapy? Is there any module that we can combine everything so that we can treat our depression and schizophrenia patients?
No, there are two ways, madam. I think one is, of course, those who want to choose yoga as a professional career. There is, of course, starting from the Bachelor of Yoga and Naturopathic Sciences to MSc in Yoga is there. And for those medical people who have done their either Ayurveda or MBBS, some institutions are offering MD in Yoga, which is, of course, is a very early, it has not unfolded into many other institutions. For various reasons, MD in Yoga doesn't come under any commission to be given a license to that effect. So this is a limitation that I think we need to probably overcome shortly. However, certificate courses in yoga have been offered in some institutions for medical people in a selective way you want to practice. For example, Nimans is offering some simple approaches in mental health care in our OPD clinic or inpatient clinics, applying yoga. And this course has been going on, and medical doctors and clinical psychologists and psychiatric social workers have enrolled. This is 5th or 6th batch which has been completed, and each batch having anywhere between 40 to 80 trainees to go through, the details of which are available on the website of NIMHANS, and if you want to avail some such certification, you are free to get yourself enrolled onto that.
Good afternoon, sir. Sir, since you are emphasizing on integrative medicine, so my question is, in Ayurveda there is a concept of Prakriti, that is an individual constitution of a patient, and treatment is based on the treatment protocols are based on the constitution of that patient. So similarly, there is also a concept of Manas Prakriti. So in this context, do you see any scope in modern psychiatry for developing personalized yoga-based interventions for a person's?
Yeah, it has a highest potential. In fact, Ayurveda-based Prakriti, you are speaking in front of a master in that area who has demonstrated even the genomics are determined, they determine the Prakritis. So it is known Prakriti and Gunas have been implicated in helping us choose a treatment approach. In fact, if you do come to NIMHANS, the Integrative Medicine Center, all psychiatric patients and even neurological patients who have come with neurological illnesses are assessed on this Prakriti model, and based on that, the food and many other Panchakarma procedures, the yoga practices are tailored to that individual based on that. And in fact, somebody mentioned in the morning this thing, clinical dietics should have the concept of pathya ingrained into that, and that will both, whereas we talk about that given individual, whether for a given disease, whether he should take more sugar, less sugar, etc., etc. We here are talking of even healthy persons, what we need to advise food, and for what season, what food, which you are familiar with the whole thing. So precisely the yoga which says yuktahara viharasya, you have heard that verse from Bhagavad Gita. So yoga involves many walks of activity, not just a posture or a pranayama. There are many, many more things, which if put together, yogo bhavati dukkhaha, it makes sure that suffering is mitigated.
Thank you, sir, for that wonderful lecture. A lot of learning for me there, sir. One question is, as a practicing physician, we come across patients, and many a time, and I know a lot of my colleagues as well who do believe in the efficacy of yoga, because most of them are the ones who practice it themselves. But when we come across patients with various, like for me, neurological conditions, now I tell them that you start doing some yoga practice. Now the question they ask me is like, what yoga practice should I do? And that is where I am completely stumped. I don't know.
You have a point, sir. In fact, there are many yoga protocols that have been promoted for different conditions. In fact, NIMHANS has taken the lead for the last more than 10 years. And different yoga protocols have been validated, standardized, and including external validation with some biomarkers and studies have been published on various disorders, psychiatric disorders. More recently, one on Parkinsonism and one on some demyelinating conditions, and 2-3 protocols in neurology also have come. And I think they are updating the protocols. I am not saying that this protocol is the final answer. We probably keep using it. This is for the beginning, and maybe as we keep using it, the experience tells us some procedures can be reduced because they are not necessary. They have to be added, the order has to be changed, the length has to be changed, and so on and so forth. We will probably evolve over the course of time. But an attempt has been made for the questions which are posed by allopaths in many of our presentations. What yoga should I practice? Baba Ramdev says something, Sadhguru says something, Shri Ravi Shankar says something, some other school of thought says something else. What do I do? So we have come up with validated yoga protocols. But I am not saying that what I have validated is the truth. Of course, the final answer can emerge as we continue to put that into application. But it is a beginning, and we have made this. And there is a website of the Integrative Medicine Department at the Nimans, there is a link to that. Many of these protocols are already published and available on the website. Sir.
Thank you, sir. So my question was around the data that you showed about China, where they integrated modern and traditional medicine. Did they measure the outcomes according to the modern medicine?
I can go to China. I'm not a protagonist of, I'm not an advocate of China. I'm just giving you one illustrated example of how modern medicine, modern science and traditional medicine, if they join hands, you can come up with some discoveries. I'm sure more discoveries can happen in Ayurveda and in yoga or in any other conditions if modern science shakes hands with tradition. That is the point I'm making.
Okay, thank you.
Sir, since you have very objectively established the value of yoga, especially in depression, anxiety and depression seem to be the two modern epidemics among particularly young people in this country. And we see every day how many youngsters are committing suicide. So is there a role for introducing yoga as a prophylactic across the spectrum in all younger people? Maybe those who are from say 15, 20, which is the maximum period of stress.
In fact, yoga as a self-empowering tool for reduction of stress has been conceived, proposed by several people. It has still not come to play as a national program at this point of time. Like I was mentioning, the attempts made by the National Medical Commission, the undergraduate board said that the stress is very prevalent in medical students, and so in the foundation course, some 40 hours of yoga should be introduced, and this should culminate in the International Day of Yoga mass practice. Common yoga protocol to be taught to all students when they join, hoping that this will have some immunizing effect against stress. That was introduced. I'm sure we cannot mandate. We have given the recommendation as a practice guideline. As a practice guideline in your education. And many colleges have already started doing it. We have the results in a public health research, not my competence though. I'm sure those who are working on public health research would have to come up with some method of evaluating impact if this is happening. One thing that has happened, one impact very, very obliquely associated with this is one of the states has mandated that in their internship there is a 1 month elective postings outside of their recommended subjects, which the students were choosing. The undergraduate board of the NMC allowed Ayush postings also could be chosen as electives by the students. It's interesting to note that one of the states has said that Ayush postings have been mandated in this 1 week of 1 month of elective posting. 1 week they are posted to various Ayush centers. Legitimizing Ayush training in modern medicine, first small step we have taken. I'm sure it will unfold into it. Madam was saying, how are you going to integrate education? And we have made a step. I think we need to go in a very, very long ways.
Just to add to what you have already given the answer, we have already introduced this as elective, as a yoga option, elective 1 month post for yoga training and learning. Secondly, to tell you that in new education policy there is a mention of yoga, and it will be coming up by 2020.
Okay.
sir. So my question is like in one of your studies you talked about telemedicine treatment and like how was the adherence to the treatment observed in that patients? And the second thing is like the consistency of the yoga practice, like how it can be checked in patients, because it is very easy to pop pills than like practicing some yoga or meditation. So how the patient can be observed for consistency to get some effects, like if like patient has to practice for minimum 3 months or 6 months to get some results. So popping pills like it won't be like I'm not telling like instantly gets the results, but it is like faster than practicing some yoga practice, right? So
so you are saying daily practice of yoga may not be as good. It's a possibility.
Yeah.
Yeah. You are right. A large study was undertaken by demands comparing tele versus in-person practice of yoga. So that means when the person with a common mental disorder was prescribed yoga, first 1 or 2 days they will do it in person, they will practice. Subsequent practices happen on a tele-education versus. Very interestingly, after the first introductory yoga 2 days, most people said we would like to shift to tele-yoga. We don't want in person, we don't want to come. In fact, there are 2 publications that have happened on barriers of yoga implementation in health sciences. And one of the barriers is having to remain in contact with yoga therapists and yoga learning. If traditional yogis are here in this hall, they would definitely scout at the fact that we teach yoga without the yama and niyama, without a few other things, and without having to have contact with the individual, making sure whether his back was straight, he was breathing, inhaling while breathing backwards, exhaling while breathing forward. We are making sure that the tele will happen or not. All these things they will frown at us and say that what you have done is not yoga. The fact is, even if it is not yoga, it is producing some benefit. If we do it as the way they are saying, maybe you will get even better benefit. I am not disputing that thought. I am not disputing that we may be producing a low potency yoga compared to high potency yoga if they want it to practice. Yoga means high potency. But it's possible that way of looking at it. In fact, when initial publications of mine and conference presentations of yoga in depression, in some of the yoga forums, yoga meetings which happened, the question was that, sir, if you are depressed, do you think you will be able to pay attention to your yoga? He won't. So the same way, you need practice. But more people practice tele yoga following Baba Ramdev than those who are feeding on the yoga on the ground. So it has become popular, sir. Technology has changed people. But I am not saying that is the solution. Physical has several benefits. In fact, we have talked about research. Physically practicing yoga with the yoga therapist live has a potential of promoting mirror neuron activation. It will facilitate what we call as social cognition. The research we began, now some were doing the research, left, and now we got abandoned. But there is a potential in live situation. We will be promoting better yoga effects than
thank you, sir.
Sir, I would like to say something on this. I am a yoga practitioner and practicing yoga since 25 years, and Himalayan yogi is my guru. So I follow whatever he is. So whatever our Indian tradition is, Guru Shishya Parampara, I am following that. And when I am teaching the students, they come to me, whatever I tell them, they are getting the results. But is there a way where I can validate or have some recognition that yes, this is working? So if this is happening on personal level, if I want to take it on a larger scale, is there any way where I can validate this is my method and this is how it is working?
So you are saying some yoga schools mandate procedures in a given way. That's the reason why I am telling you that these generic protocols where this has been taught in a standard MSc course or a BNYS course. These are all there in the textbooks. And we are using them. They are available, which are so-called yoga pharmacopoeia. Whatever you want to use it, it's available and we want them to use it. So that takes away school of thought's pressure. I'm definitely not disputing the fact that the school of thought has a scope. In fact, even medicine has been taught. I'm sure some of the physicians believe that a treatment of a given condition, some of the senior physicians believe this is the way it should be done and not the other way around. In the same medical institute, medical college, I know one unit had a policy differently than another unit of treating people. Of course, today in the last 30-40 years, treatment guidelines have tried to make them more uniform. I knew when I was studying medicine, and I'm sure many of the senior people also will agree, that in the same college, in the same department, two different units had a different way of approaching, starting from even a surgery. So, school of thought has influenced medical practice age memorial, yoga also, but I'm sure we will slowly move towards making it a little more democratic.
Namaskar. Just now it was asked about the validity of yoga. I am going to explain this. Why the validity of a yoga is necessary? Let us ask the validity of a Bhagavad Gita. That is the problem. Why it is necessary? It is already mentioned, it is valid only. Again, why this intervention, all these things are required? Will you please explain? And I would like to put one thing. In Hatha Yoga Pranayama, one sloka is there. It is mentioned that Pranayamena yuktena sarva roga kshayo bhavet. Ayuktena pranayamena sarva roga sambhavat. It is not validated. If you want to test this, you can test it, but it is already validated. But I feel to explain. One more thing. In Bhagavad Gita, one slok is there on the pranayama. And that slok is the Apane juhati pranam, prane pana tatha pare, prana pranagati tha pranayam prayam. This is not validation. In Bhagavad Gita it is mentioned. And why? Because we are not straightway saying that it is validated already. Why again experiments are required? Yes. Please elaborate.
In fact, I don't know whether you noticed, one of my slides I said, the very first slide, I said, time testedness has been said over, no need to test it again. In fact, I even now get this comment, just as I had this comment now, in yoga meetings, they will say, what nonsense, you are doing some new method to test established ones and this is not going to pass the test. Forget it, this is not the test. So these arguments have been there, sir. I am 100% agreement with your logic as a believer in all this field. But the point is, the world expects something else and research has been happening world over. And Harvard scientists telling that Bhagavad Gita is very useful to medical education, led to psychiatric education, led to one of the colleges introducing a course on Bhagavad Gita for psychiatric. So, but we could have done it on our own. Like the sir was saying, if Patanjali is not the reference text for psychology, what else? So these are all there. Nonetheless, research has to happen, and I think with all these things, there are a big chunk of people who still don't believe that these are all scientific. In fact, you of course have seen many things. I also believe, and I am 100% agreement with you. In fact, in the very first slide I said, time testedness is the gold standard.
Thank you any questions. Thank you, sir. I would now request Dr. Didi sir to come and give a word of thanks.
Thank you very much, sir, for your precious time and experience shared with all our students. Our students are really enthusiastic, and this particular talk will be again referred to in many of our sessions. For first year, we are having the basics of yogasana and physiology, and second year students we have NCDs, and our students, they are going to make a very big poster, NCDs and lifestyle, and there has been also an assignment on yoga, etc. So thank you very much.
I must tell you, although I have demonstrated this in mental health, there is a big book on yoga and cardiovascular diseases. The diabetologist group have put lifestyle, mind-body practices, including yoga, as a treatment package in treatment of diabetes. Neurological conditions, there is a book written in the Indian Psychiatrist Society, Yoga, Art and Science of Application in both mental health and neurosciences. So I think more and more NCDs are embracing yoga approaches or traditional approaches. I'm sure more and more guidelines will follow on this.
Thank you, sir. I also thank Patwardhan sir, Professor Rajan sir, Rahulji, Rathi, Professor Rao and Professor Agar Khedkar sir, Dr. Sarika Chaturvedi, Dr. Juhi, and many of our friends. Thank you for attending. We will have a group photograph. Yeah, please. Thank you.